Another day, another record. Edging closer to 50,000 new daily cases, Victoria, Tasmania and the ACT with particularly sharp spikes. With rapid antigen tests nearly impossible to find and the closure of 82 PCR testing sites across Victoria and New South Wales, actual case numbers are likely to be much, much higher.
Almost 1 in 4 now of the cases that we're testing coming back as positive cases.
In New South Wales, 27% of PCR tests are positive. For authorities, though, it's all about keeping calm and focusing on the health system.
Importantly, those hospitalisation numbers are remaining stable.
The key focus for us, we monitor every single day our hospitalisations and our ICU capacity.
But that curve doesn't look great either. While ICU numbers remain much lower than the Delta wave, New South Wales has passed its previous peak for hospitalisations.
The number of cases that we expect to see in hospitals have already increased significantly over the last 10 days, and we expect to see those trends continue.
A perfect storm seems to be brewing. The breakdown of test and trace systems creating more pressure as people flood emergency departments.
Only a small percentage need the ICU, but if you start infecting hundreds of thousands of people a day, ends up becoming a substantial pressure on the system.
Meanwhile, the booster rollout is taking health workers out of hospitals as they deliver jabs. And well-earned annual leave is further depleting a workforce already burned out by 2 years on the front line. The staff shortages in New South Wales now so severe, COVID-positive nurses have reportedly received unofficial advice to return to work in some hospitals.
A lot of cases coming in with COVID and a lot of staff getting furloughed at the same time, so there's this double whammy of the ability to provide care, not just for COVID but for everything else.
In the face of extraordinary challenges, authorities believe frontline workers will hold firm.
Our health system has shown amazing resilience throughout this crisis, and Australians should continue to have confidence in the calibre and capability of our health system.
But do those on the front line share that optimism?
Well, Dr. Stephen Parnas is an emergency physician in Melbourne and he joins us now. Dr. Parnas, we're continually told that Omicron is different to Delta. So tell us, what are the pressure points in the system this time round?
It is different this time, absolutely. Because we have such an infectious variant of the virus, it is spreading like wildfire. Thankfully, it is a less severe variant. So in the health system, we're seeing huge demands on testing centres, on emergency and community-based healthcare. But even though there are fewer severely ill patients, it's still putting enormous strain on the whole system.
So if these numbers continue to rise at the rate they currently are and the system is overwhelmed, what breaks first?
Well, I doubt we'd see one single event that says we're in big trouble. I think what we would see is progressive delays, things like ambulance call-outs, times to be seen in emergency. Inevitably, the longer that those times blow out, the more likely an adverse outcome is, something like an avoidable death.
Stephen, it strikes me that every time we talk to you, the government at some level is saying everything's under control, everybody needs to calm down and not think the worst is going to happen. What is it like right now? How important is this moment? Can you give us an honest take?
I am concerned about the government response if it paints too rosy a picture. For example, I don't think the New South Wales health system is strong and going strong. I think it's facing challenges that have never been seen in my lifetime. We need to be honest to keep people's confidence and trust in place. I think government definitions have a place. You know, you can redefine close contacts, and I think that's not unreasonable at the moment, but I don't want to see redefinition of what a hospital case means, because the impact of any COVID case is huge. You can't redefine a problem out of existence or minimise its impact. We've got some hard weeks in front of us, but I take comfort in the fact that as a nation, we've gotten through some very nasty waves over the last 2 years. We will get through this if we follow some careful, sensible instructions and not look at who to blame, but look at what we can do to get through it.
So, Stephen, if you could break into the National Cabinet meeting tomorrow and suggest one thing that you would like to see put into place that could help the current situation right now, what would it be?
I think that's an easy one to answer, Georgie. It's let's stop playing games with the issue over cost for rapid antigen testing. If we continue with this nonsense that people need to pay to get access to these RAT tests, then we're going to see a disproportionate number of people get sick in the suburbs that have lower socioeconomic status. And that's the last thing that we want in Australia. We've not run the pandemic in that way at any time in the last 2 years, and we shouldn't be starting on it now.
So, Stephen, on the point of rapid antigen tests, Western Health in Victoria yesterday tweeted asking people not to turn up at the hospital if they want a COVID test. Would it actually reduce some of the pressures on the system right now if rapid tests were being made available freely?
I think it would make a difference for the better if people could access the RAT test now. If you do a RAT test in your own home, you test positive, then for the majority of people who have only mild symptoms, that means they can stay at home, isolate, reduce the spread, and put less demand on either the PCR testing centres across the country or, for that matter, hospital services as well, and reserve those services for those that need them most, i.e. emergency for emergencies.
Everyone's had such a difficult 2 years, not least of which the frontline healthcare workers. How desperate were you and your colleagues to have a break this summer?
I was really blessed to have Christmas Day and Boxing Day off, and that re-energised me to be able to really put in some longish hours over the last week and a half. We've got self-care as an absolute priority, as it has been in all the other waves. We know that with these sorts of marathons, you really have to pace yourself, and no one has the crystal ball to tell us how long we need to step up for.
And we thank you for that dedication to you and all the frontline workers. Dr. Stephen Parnas, thanks so much for your time this evening.
Thanks very much, Lisa.